Tuberculosis is a curable disease. Unfortunately, in India, even today, almost 4 lakh people die of tuberculosis. So it becomes a responsibility of the medical profession to prevent deaths of a curable disease. India has got the highest burden of tuberculosis in the world. Almost 25% of the tuberculosis patients in the world are in Indians. And amongst the Indians, 50% of the patients avail the services of private practitioners as far as their tuberculosis or chest symptomatics are concerned. So the private practitioners have a very, very important role in tuberculosis control and to decrease the burden of TB for the country. Indian Medical Association is sensitizing doctors on the proper diagnosis and treatment of tuberculosis with the objective of supporting the National Tuberculosis Program and reducing the burden of TB in India. The standards of TB care in India have been evolved, and this would be the guideline for all doctors and establishments in the management of tuberculosis. Indian Medical Association is working in 15 states and has so far sensitized more than 1 lakh doctors on the National TB Control Program and the standards of TB care in India. We have also trained about 18,000 doctors who are interested in TB care management and dedicated TB care work, and these 18,000 doctors will continue to serve the community in TB care for the rest of their professional life. The Government of India has mandated that tuberculosis is a notifiable disease, mandatorily notified by every doctor who diagnoses tuberculosis. The IMA is facilitating these notifications from the private sector, and as of today, in November 2014, we have facilitated the notification of 77,000 new patients of diagnosed in tuberculosis in the private sector to the nodal agencies. We also wish to establish private peripheral health centers as a one-stop center for tuberculosis in private sector, and many patients who want to utilize the services of private sector will be utilizing this facility for the diagnosis, for the treatment adherence and complete cure of tuberculosis, so that we will partner the government in TB care activities in the Indian nation.